Welcome everyone to the PGN speaker event. It's called Iboga, Reconnecting with Traditional Medicine. And my name is Chi. I'm based in Costa Rica. I'm filling in for Ashley today as one of the hosts for today. And we're just going to take a moment to relax and breathe, maybe close our eyes. We're just going to take a moment of silence, maybe 60 seconds or so, to ground ourselves, to presence ourselves. Beautiful. So first I'm going to introduce PGN very quickly. So PGN is a community of psychedelic professionals who are committed to ethics and engage in peer consultation. PGN is also the only network we know of purely dedicated to community through peer circles. And PGN is a network on a mission to sustain the sacred and increase the integrity and resources of psychedelic guides. So usually one way we do that is we host wisdom circles where a group of people gather every 2 weeks and talk about cases and what they're going through. And also wisdom keeper events like this, where honored guests show up and they share a little bit about who they are and their practices, their wisdom. So the community membership is a great place to start. If you're unfamiliar, feel free to text the PGN, or feel free to text the yes, here I'm going to introduce our wisdom keepers today, Michelle and Patrick Fishley. So Michelle has been an LPN for 16 years, dedicating medicine. As a medical director and lead facilitator, she has guided numerous retreats, combining her expertise with certifications from Being True to You in recovery, psycho-spiritual integration coaching, and the Institute for Integrative Nutrition. Her deep passion for Iboga led her to Gabon, where she underwent initiations into the Niembe and Mabundi, the feminine form of Bwiti traditions. This year, she was ordained by the elders as a Ganga, which means seer or healer, and given the Bwiti name Yaketa, meaning mother of twins, mother of all. With her is her partner, Patrick. Patrick has dedicated 30 years to working as an RN in the ICU and ER, with extensive experience in addictions and mental health and psychiatry. He's certified in addiction recovery, psycho-spiritual integration coaching by Being True to You. He began working with plant medicines in 2012, focusing on Iboga and ibogaine. Patrick has provided medical services, coaching, counseling, pre-screening, and integration, serving as a lead facilitator and medical director for retreats. He also organizes annual trips to Gabon for traditional experiences with Iboga. As a Misoko Bwiti initiate, Patrick, known by his Bwiti name, Dibadi Mabunza Mukuku Akanja, is an ordained Ganga, which means seer healer, and an active member of Maghanga Mazambe, a national association in Gabon dedicated to the practice of Bwiti and Iboga. Together, Michelle and Patrick founded Soul Reflections, an online community offering support for pre- and post-retreat preparation and integration, as well as educational resources for those wanting to learn how to support others in Iboga and ibogaine. So without further ado, here are Patrick and Michelle. Take it away.
Well done, Chief. Those are some hard words.
Yeah, that was awesome. Thank you so much. And I just want to say thank you, everybody. We feel very blessed and honored to be here and to be talking about this beautiful medicine, which is very close to our heart, and really talking about, reconnection to traditional medicines, which we all, I think, very much need. So Patrick and I are just, like I said, we're just very honored to be here, and we're very blessed that we've been able to take this journey, first with nursing, that really, I think, helped prepare us for where we are today and working with this beautiful medicine. And so, yeah, it's just been a blessing for us to be able to go to Gabon and to work with the people in the village and to continue our learning and understanding of what healing is.
So I'd like to take this time to kind of introduce you to a few of our elders and our main teachers. On the top left, we have Papa Sastan, and he's initiated into the Tsumba, the Masoko, and Gande, and Nzego as a Ganga. He's a Mwiri master and a spiritual leader. He is a community leader, a gifted woodworker, and of arts and crafts and everything. And he's a beautiful healer as well. He gives so much time and his knowledge effortlessly and tirelessly, to all those who come. And he invites everybody into his audience and under his wings. And he wants to share what the tradition means and what the medicine is and how it can work with everybody. And even though there's a, French to English barrier, he's learning a few key words like, sit down, stand up, which is really useful sometimes.
Yeah.
And so there's challenges, but we have interpreters, and he's a beautiful soul. On the bottom left, this beautiful woman there is Mama Nunu, and she is a Mabundi Ganga, a Nyembe master, and a spiritual leader. She is the community leader in this village. It's her village. Goes by Mama Nunu's village, and she supports many people in and out of her community. And she's also very revered, and she's a very gifted healer, and she travels around deep into the jungles, healing and everything else. She is such an inspiration of what love and devotion truly is. She puts herself at last at all times for everybody. And when you come to her village, she treats you as one of her children, and she will do like any mother will and give everything in her all to you. And this beautiful lady in the middle is Mama Yaula. And she's actually married to Papa Sastan. So it's amazing to have this masculine and feminine teachers right together serving this masculine and feminine medicine of Iboga. And she's also a Mabundi Ganga and a Nembe master and a spiritual leader. She's a community leader teaching the initiates in Gabon and also in our Soul Reflections community. And she works so diligently, so hard, gives so much of her time and her love to everyone, and it's emanated by her actions and just by the look on her face. It's very important to understand, though, that all our teachers, they also have a community of peers and elders that help guide and direct them. They work diligently to continue their own growth and their own learning, as far as Bwiti goes, because it is a lifelong tradition of learning. Here, you'll see just a couple snapshots of some of the people who are helping. On the top left, this guy's name is Dengwese, and he's considered Papa San's right-hand man. He goes everywhere he goes. He's a gifted healer, a gifted craftsman, a beautiful singer, and he plays the instruments like crazy. And everybody there, including the 6-year-olds, play all the instruments. They're all masters. It's just incredible. And we see these two brothers in the next slide, Akumi and Mac. And these guys give their time so effortlessly and just without want for anything and tirelessly. And here they're reskinning these drums for the ceremony tonight, where they're going to be played for like 12 hours straight, and then they just beat the living tar out of these skins. And there's this, it's just so beautiful to watch them in their crafts. In the middle top, there is a traditional Bwiti temple. And there's a post in the middle, and on what you go on the right side, you come out the left side. There's always a fire burning outside, and there's a fire burning inside. A very traditional temple for initiations, for ceremonies, for celebrations. On the top right, we see Papa Sistan, whose Bwiti's name is Mahanga Mabango, and he's putting on some of his regalia. He has so many different faces for many different things that he does. And everything from the straw hat to the skirts to the bells on his feet, they all serve a purpose. They all have a reason for it. There's nothing done by accident. It's all done very intentional. On the left, you see this shining star. Her name is Dizona. And as much as you see her right there, she's very much a bright light in a dark area. She just shines. And when she dances, you can't help but be swept away with just this love and compassion. In the middle of the bottom is Yaula again, and she's carrying a traditional women's gathering basket, which they take into the forest and they load up, and those things get heavy. I tell you, they get heavy, but especially these women are just fierce. On the bottom right is a group of Nyembe initiates that were here this last July. And there's a couple of people there from the West there. And that's with the women's rites of passage they're going through.
So what is Iboga? So Iboga comes from the plant Tabernathi Iboga. And it's really quite an unassuming shrub that grows in the jungle with some really unique and incredible psychoactive properties. Iboga is not a true hallucinogenic, however, but rather what's called an aneurogenic, meaning to dream and to create, which is the perfect way to describe what happens when we're experiencing medicine. Ibogaine, and it's important that we talk about both Iboga and ibogaine because often we find people use those two things interchangeably, but they are different. So ibogaine is just one alkaloid from the iboga plant, so that's a very important distinction. Iboga is used for spiritual connection and growth. It's used for healing of the body. It's used for having a deeper understanding of oneself. In small doses, they'll use it as a stimulant or for energy, if they're going to go hunting or dancing all night in the temple or anything that's going to be highly physical. It's a beautiful, beautiful plant for healing mental health conditions and disorders such as addiction, depression, and anxiety. And really, Iboga helps solve our problems. It's why it's here. It helps us solve our problems in a way, it allows us to see outside the box. Many people, when they come to Iboga, can have, a complete paradigm shift in the way they are viewing or seeing the world. So it is a very incredible and beautiful plant. So where does Iboga come from? Iboga grows only in Central West Africa. So that's mainly Gabon, Cameroon, and the Congo. People have tried with very little success to grow it in other areas, whether it be sort of in a lab sort of kind of setting or in South America, where the idea is that it's very similar conditions, humidity, soil, that kind of thing, but it just doesn't really like to grow. And even if they do get it to grow, then it often won't have the same psychedelic effects. And so, that causes problems that we'll kind of discuss later on. But the people in Gabon have been using this medicine for a minimum of 2,000 years. And that's like sort of, quantify, they found evidence of usage 2,000 years ago. So They've been using this medicine a very, very long time. And the Bwiti tradition is the tradition that supports the medicine. So Iboga, so Bwiti was actually there prior to them discovering Iboga, but definitely Iboga since then has helped shape the Bwiti tradition.
So, how did Iboga move from the village globally? Between 1930 and 1960, ibogaine was sold and patented in France under the name of Lamborghini. It was touted as a mental and physical stimulant, and it was also used by athletes, to treat depression and anxiety, and for virility and for extra strength. In 1962, Harold Lotsof, he was a heroin addict. He accidentally discovered ibogaine's anti-addictive properties. He had a chemist friend who said, "Hey man, come over here and let's try this. It's a psychedelic, it's pretty cool." So he did. And a few days into it, realized that, hey, I'm not having any withdrawals. I'm not dope sick. And he realized that there was a addiction interruption. So he planned his rest of his life on pursuing the studies of ibogaine and its properties. The anti-addictive properties accelerated the use of ibogaine and iboga, but it created, scientific and anecdotal notes, reports for its positive outcome for addiction, mental, and physical well-being. There's been many studies back in the 80s, and then now again, more recently, and there's still current studies in Stanford and Washington, Kentucky, and other schools presently. And then, of course, there's a handful of places that are studying vets and with traumatic brain injuries and PTSD and the correlation with the efficacy of treatment and having very, very good outcomes. Iboga and ibogaine are still considered controlled substances in most countries, therefore they're illegal. The primary reasons being the negative effects that iboga and ibogaine can have on the heart. So what is this Bwiti tradition? What is it? So Bwiti is a tradition that supports the use of iboga in Gabon. Okay, they utilize it. They utilize this tradition for initiations, for healing, for meditation. They use it for spiritual connection and connection to nature. They have a saying that if you abuse nature, the price is misery. And you are nature, right? Get it? So it's really, the study of life, of your life. Within the Bwiti, there are multiple branches, including the Sumba, the Nende, Misoko, Mayobi, Ngande, Mabundi, Mabanji, Asangadia, and Fang. And they're very similar in all their traditional holdings, except each one holds a specific specialty. Now, we're part of the Bwiti Masoko, and we're revered as hunters and the healers of the body and healers of the mind. The Bwiti tradition helps initiates understand the world around them and what's going on and how they fit in. Once a lesson is taught, it is then up to the initiate to bring their own meaning and their own understanding to the lesson. Because through the Bwiti and through this medicine of Iboga, you will get answers, you will find truths. But one thing it doesn't do, you'll also find relief of addiction. But what it doesn't do is take away your choice. You still have to make a choice to listen to what the truths are, to make the changes, to implement it. But it's a really great tool and a really great tradition to help support you through your life and your study of life.
So iboga versus ibogaine. So what are these key differences here that between these two beautiful medicines? So iboga again is the Tabernathi iboga plant, where ibogaine can be taken from Tabernathi iboga or another plant often used is Bokanga iboga. Iboga, though, unfortunately, has the highest concentration of ibogaine in it, so is still often the preferred plant to use. Although Bokanja iboga grows more readily in other places and is like, a plant that's happy to grow in other places. Iboga is the whole plant. So mainly we use the root. Although the whole plant is psychoactive, the root is where the concentration is. So the root is usually used, and it has many, many alkaloids in it, over 100. And which is quite unusual in the plant world to have so many alkaloids. Whereas ibogaine, again, is just that one alkaloid. Iboga is used in traditional settings. Definitely when we're using it and talking about being used in Gabon and South Africa. But also when you see it being used here in the West, iboga retreats tend to have more of that tradition. They pull from that tradition. Whereas ibogaine often is more clinical. It's more of that sort of sterile medical center. And I really think probably somewhat leads to the more or less spiritual connection. And with iboga, we're using individual dosing. So, we're using a bark, we're using ground up dried bark and serving that. That's what people take. You can take it orally or as a tea. Some places will use like a very concentrated, they call it a total alkaloid. So it's like the alkaloids with the bark taken out. But it's very individual. So you would start with a small amount and you would kind of build until, the person was in their desired place. Where ibogaine is going to be milligram per kilogram, somewhat dosing, where it's very, that more clinical, scientific, this is, the way we're doing it kind of thing, and less individuality in that, although there is a little bit. If you have a good ibogaine provider, there still should be some individualization in that. Iboga is psychospiritual, it's for addiction, it's for mental health, it's more rounded, in that way, where ibogaine is mostly for addiction. Its use is mostly for addiction. And it does have some psychospiritual properties to it for sure, but it's just not as strong as iboga in that way. So there are many unknown alkaloids that have not been studied with iboga. So out of those over 100 alkaloids, only about 13 or 16 of them have been labeled and studied, right? And whereas ibogaine, of course, just being one alkaloid, of course, has much more quantifiable characteristics, and science loves that, right? Science doesn't want a plant that's got 100 alkaloids that they can't say, well, this does that, and this is this, so you'll see what happens if you search for research on iboga, you will almost always get ibogaine studies. So it's very important to know that, because that's not iboga, right? Because we're just talking about ibogaine. And iboga is a mind, body, and spirit medicine. It just works on the whole person, and it really is dependent on what that person needs. And this plant is incredibly intelligent. And so it's what you need in that moment with that ceremony that's really going to direct the experience you're going to have with this medicine. Ibogaine feels more psychedelic in the sense that, it's a bit more predictable. It has a flow, right? It doesn't have the same it doesn't have all those other alkaloids in there kind of stirring the pot up, right? So it's a little bit more predictable that way. Iboga is physical, mental, and spiritual detox. So iboga loves the mind. It loves to work on how we use our mind and how we're using our mind maybe in ways that are no longer serving us. Cleaning out that body and really connecting us to our spiritual and cleaning our spiritual body as well, where ibogaine really is that physical detox for the addictions and that kind of thing, and there's definitely some mind in there, but more limited in its spiritual, because it's it's been pulled right from the whole. And Iboga may be a visionary experience, but not always. And I think this is the hardest thing with Iboga. People often compare it to ayahuasca or mushrooms, and it's so different. And they can really struggle when they don't have this big visionary experience. But Iboga can be it can be very auditory, it can be intuitive, it can be like the most intense meditation you've ever done. You know, it's really quite incredible that way. Where with ibogaine, it's similar. It can have visuals, but not often and not always. And it often is a very intuitive way of delivering messages for you. So it gives you insight, you know, into some of those traumas maybe that have been leading towards those addictions. Iboga, it lasts much longer, so 48 to 72 hours. So not necessarily intense, like top 48 hours, but you know, that really intense portion is usually less than 8, and then it kind of moves through as you go through different insights and stuff. But it is a long acting medicine, and ibogaine is about 12 to 24 hours. So people are up and about much quicker after ibogaine.
You know, it's not whether one is better than the other. You know, there's no competition. You know, it's basically from the same plant. They both work on so many different things, you know, and they can work very well together. You know, while ibogaine is best utilized for addiction interruption, iboga tends to be more utilized for the psychospiritual healings. Ibogaine is more concentrated because of its HCl, hydrochloric alkaloid content. Iboga has the power to also tend to addictions. A few years ago, we did a movie called Dosed. You know, in that movie, we had a young lady named Adrian, and by her words and terminology, she was a garbage can junkie. You know, coming with many personal and mental health concerns, on a plethora of mental health medications, and not being able to thrive and move forward in life. And she found relief through, you know, quite a few ceremonies with Iboga, but is peeling the layers back in a way that helped her move forward. You know, since then she's been, you know, plus 5 years clean, and she's moving forward beautifully. So, you know, ibogaine is great for scrubbing and getting in there, detoxification of the body and the mind. You know, it does a really good job with that. Iboga also detoxes the mind and body. You know, it's really good for getting in deep, but it also goes deeper, much deeper into the conscious and the subconsciousness, you know, helping the participant heal and work through their traumas, their maladaptive coping skills, you know, and behaviors, and their memories, you know, their childhood traumas. It helps you get way deep inside. And I always say, you know, it's not why the addiction, it's why the pain, you know, under the addiction. It's what's driving the train, what's pushing the cart with the horse behind it. It's really about knowing that.
So the benefits of Iboga. So there are many benefits to Iboga. But some of the really big ones are, you know, immune support. So anytime we do something that helps reduce stress in our life, reduce cortisol levels, you know, that helps our immune system. And Iboga beautifully supports the microbiome. And of course, that is a big factor in our immune system. So it's a really beautiful medicine that way. It's anti-parasitic, it's anti-inflammatory. Again, that also helps our immune system, but really that anti-inflammatory process is such a big driver in a lot of autoimmune disease, right? So really a beautiful anti-inflammatory medicine. It alleviates, you know, these mental health conditions that people are often suffering for, helps to alleviate them, like PTSD, depression, anxiety, traumatic brain injury. There's lots of really great studies now with ibogaine, especially for traumatic brain injury, and helping, you know, with those. Iboga gives us clarity and insight into our life. It's a beautiful detoxification. And really, this is really important for people to understand, because Iboga will make you medication naive, not just drug naive, but medication naive. So when people are starting back up, maybe on specific medications that they had to pause before they could come to Iboga, they should know that they could be more sensitive to them. Of course, it interrupts addiction and is a wonderful support for Parkinson's. Iboga has this beautiful way of supporting that dopamine in the brain. So there's some really great research that will be happening with Parkinson's. And, addiction, it's important to note too, when we talk about addiction, we don't just talk about the substance or, like the heavy addictions, but also we're talking about behaviors. We're talking about negative self-talk or blame, addiction to blame, right? Addiction to that victim mindset. Iboga loves to show us where we need to take more responsibility in our life. So it's a beautiful medicine there too. So I think here we wanted to pause and see if there were any questions before we move any further.
Great. Thank you both. Cassandra asked, she's curious, as holders of the medicine, do you take it when you hold ceremony? Do the Bwiti take it if holding space? Also, do you require EKG screens before an experience?
Okay, great questions, plural. So in Africa, the Bwiti will take the medicine as well. Likewise, we will take some medicine. It's obviously a much smaller dose than someone coming for healing or going through initiations. And it's the way that we can connect properly with the medicine and help channel through and help be a better guide. So we do take small amounts, like we call them working doses. So no, it doesn't actually interfere at all with our cognitive or our abilities to create a safe space. As far as EKGs, we are going to get into that right after this talk. So I'm not going to answer that right now. Keep you thinking, but that's up next.
Yeah.
But yes, we do.
Beautiful. Thank you. Does anyone else have any questions? How is it, Peter asked, how is it administered? Tea or chew? What are the different workable dosages?
Okay, so both. Mostly though, traditionally, so if we're talking about Iboga, you would get root bark into the palm of your hands, and then you would, take it that way with some water. You don't maybe chew or swish a little bit to like really get, because this is bark, right? So it's really dry. So you really want to kind of get enough water in there to swallow it down. You don't want to chew it for too long because it's very has some of those oils can be quite acidic. They'll be a bit rough on the mouth if you keep on chewing it. Tea is another way to take it, although not as common. But definitely a way they definitely take it, both in Gabon and in some and ceremonies. And then ibogaine is taken in pill form. So those are the most common ways.
Plus also, Iboga can be in the form of protoalkaloids in a capsule form as well. You just swallow those and they're pretty easy.
A little easier, especially because Iboga is very bitter. It's a very bitter medicine. Although we did have one lady say it tasted like peanut butter, but that is not the normal consensus.
On a couple of ceremonies yet, so.
Yeah.
We're still looking into that, studying that.
We haven't repeated that taste yet.
We're looking for more participants to check that out.
Any comments on workable dosages?
So dosages, so it's very, so whether it's ibogaine, because I've worked with that as well, or whether it's Iboga, it's very dose dependent on the person. Even when I was working in emergent ICU, just because the doctor writes, this is what you got to give the person, when you go to the client, to the guest, to the patient, that might be too much. You have to consider where they're at right now, how things are moving, where they are, and you might give less, you might give more. but it's really depending on how they are interacting. So really, as far as dosing, it's very stackable. So you start with a little bit, then you add to it, and you give it enough time in between so it flowers, so you can see the results. And so because you can always give more, but you cannot take it away.
No.
You know, and that's where people can get into problems. And that's where, you know, we'll touch more on that in the next screens coming up, but it's really those dependent on how the person's moving through it, and to be able to be aware and understand what this looks like ahead of time, so you can create that safe and space and environment for the guest who's coming to be all vulnerable and work through everything. Yeah. So I know it's a little ambiguous, because it's not just like we give 3 pills for this and 2 scoops for that. It's never the same for anybody.
No.
Do you offer microdosing? What are the benefits of microdosing? And is microdosing similar to mushroom microdosing? This is Azurini 77S.
So microdosing is tricky. So Iboga, as when we'll talk about contraindications and things to look out for very briefly, but there are a lot. And so if you wanted to microdose Iboga, you would have to know that there would be a lot of other things you would have to not do. It really would be a lifestyle. And for the Bwiti, if we're talking about the traditional, they would say, you know, you shouldn't be microdosing or taking Iboga on your own until you're initiated. This is, we have to remember, this medicine is a spirit, and it really pulls you into that spirit world, and it needs a little bit of knowledge to be holding it. Yeah, so although I would love to see in the future ways to safely do it, you know, microdosing retreats and that kind of thing, but and it does have some really great benefits for people, but I think we need to really, it's too easy to be microdosing Iboga and then take something that's contraindicated and perhaps getting yourself into trouble. So yeah, so we don't always recommend it.
It requires a lot of education, and that's something we're working on doing as well, and bringing forth to the public.
Yeah, you'd really have to know that that person that was going to microdose was going to do it in a really good way. And so if it's, especially if it's not, if you're not able to watch over them, you know, if you're not able to offer that support. Yeah.
Let's put it this way here, even in more layman's terms. So let's say you have a chronic toothache that happens every so often, and you don't have any health insurance, you're not going to the dentist, and every so often it hurts so much, so you take a Tylenol, because Tylenol helps with that. And so it's every once in a while you take it, and you take it for a little bit, and you stop, and you take it again if you need it, and it works good. But with Tylenol, there's real contraindications with it, because it's a real medicine. And some medications, and there's also parameters in which you can't take too much, because you can become toxic and get very sick. You can die. There's a lot of things like that. So likewise, you know, these plant medicines are real medicines, and they come along with, you know, contraindications and indications and parameters to take it. So I feel it's a lot of education needs to happen to do it safely, because it's really about safely and doing that.
Yeah, and you can find too, like you can take a small dose and really have a very profound experience.
Yeah.
So it's, again, it comes back to a lot of times people are really focused on how strong it is and what's stronger, iboga, ibogaine, these kinds of things. And again, forgetting that it's not just a plant with alkaloids, it's a spirit. And if that spirit wants to teach you something, no matter how much you take, it's going to teach you. So even people who have been working with the medicine for a long time can be taken off guard by taking an amount that they've taken before and had no problems with, and be laid flat for a day. So it's really, yeah, it's really, yeah, it's a real special medicine.
Beautiful. Anyone else have any questions they'd like to ask? Any comments they'd like to share? Okay, so it looks like we're good to go for the next little bit, and then we'll go to the end of the presentation, and then we'll open it up again for Q&A. So feel free to keep going, Michelle and Patrick.
All right,
Thanks.
thank you. So we've talked a bit about the Bwiti, we've talked a bit about Iboga and ibogaine and their similarities and such. So here we want to talk about safety. You know, this is something that's very near and dear to our hearts, being in the medical field for over 30 years. We have an obligation, and we have a promise to everybody that we meet that this is going to be held in a very safe container in a way that allows them to be their most vulnerable and move through this incredibly powerful, life-changing medicine. So what are some of the things that you can expect to see as a provider or someone helping out, or even someone who's going to participate in this Iboga or ibogaine? So one thing you can expect is ataxia, and that's just, you know, where your limbs aren't cooperating. You're not able to walk very good. In fact, you should need someone to help you walk. So that's why it's good and important not to do this alone, because there is a risk of falling and risk of injury, head injury, trauma, breaking an ankle, things like that. You know, you can expect to have at times tremors through the whole body and down your limbs, and that can be, you know, alarming to some people. But what happens is this medicine works at a neurogenical level, and it goes through your whole system, and it's creating new pathways in your nervous system. It's repairing, it's causing new ones to be made to be for more benefit to you and your body. So you'll feel these tinglings and tremors throughout your whole body at times. You know, there's nausea and vomiting, you know, like purging. And this medicine here, what it does is when it sits in your stomach, you know, this is where we have all our gut biome. We have all our serotonin is made mostly in there, and we hold so many deep emotions and traumas in our abdominal cavity. You know, so when it sits in there, it can cause a real uneasiness. You know, and it can also, when you're moving too fast, changing positions, your head, it can cause some nausea, and you can throw up. But when you have the purging, you know, there are so many ways a person can purge, and you will purge. Now, not everyone's going to purge through throwing up. Some may purge through a lot of urination or a lot of bowel movements. They may have yawning or crying or sweating profusely. You know, these are all ways that we detoxify and get rid of things that are no longer serving us for purging. We also may find that there's dizziness, you know, where equilibrium is now off. And now it's working up, you know, up in here. And it's because it's working, it's just causing an imbalance for the temporary. And so unsteadiness on your feet. So again, having someone present beside you to help you navigate through whatever you might need to do. You know, it causes a relaxation and working on the cortisol and decreasing stress. It can have decreased respirations. You need to be aware of what's happening. And it's so important to have a medical professional there who understands the medical side of you, but also the medical side of this medicine and what to look for so they can act in an appropriate time and manner to keep a person safe. You can have bradycardia or hypotension. You know, low heart rate can happen, and a low blood pressure can happen. And it's a matter of knowing where it's safe and where it's not safe, and what happens if it's starting to go down a little low, you know, and to know this ahead of time. There's a lot of protocols around that. You know, with the nausea and vomiting and everything, it's important to monitor your intake and output. While it's really important to know, you know, what kind of electrolytes, we always say give electrolytes in water before you even do the medicine to give yourself a cushion in case you are vomiting or purging. And when you do purge, you release a lot of these different electrolytes and nutrients, right? And what can happen is it can affect your heart in a real negative way. It can affect your organs in a negative way. It can cause confusion in a real negative way, you know. And likewise with the output, well, how much has the person been throwing up? How much have they been going to the bathroom? So we want to make sure everything's kept in a real healthy balance and to know the signs and symptoms before they happen. That's really a big key. You know, as far as the safety, it's also considered this cardiotoxic. because of the effects it can place on the heart. You know, one of the things is this QT interval prolongation everyone talks about, and it's really just the time it takes for the heart to refill after it's beaten. And there's definitely parameters for that, and to have a really good understanding for that. And you know, you can't just go to a seminar on a weekend or for a week and come out being confident pro and expert on reading those things. It just doesn't happen that way. There's so many variables, and this goes with the EKG that we talked about earlier. You know, it also affects the T waves, which is just another component of the rhythm strip on the EKG, and that's just the changes are due to the bioavailability of the potassium. And you know, we're peeing it out, we're puking it out, we're sweating it out, and it can cause an imbalance. And when it becomes imbalanced, either too high or too low, it can have real effects on the heart and how that's pumping, you know, and there's a lot of other things that involve with that as well. You know, and there's also effects on the serotonin and dopamine levels in the body. Iboga gives a real surge of both of these hormones to the body. You know, one of the biggest things is with serotonin, you know, it's important to know what you're taking prior to coming in the weeks coming up to it, and to be off of it. It could be supplements or foods or medications, you know, or other medicines that, you know, on their own, it raises up your serotonin, makes you feel better. But when you have something else that's going to boost it, like, you know, Iboga is going to boost your serotonin a lot. And together now it could be too high. It can give you serotonin syndrome, which can lead to a very unwanted death. You know, it's just that simple. It's nothing to play with. And, you know, it's about knowing how to look at that, how to find it, how to act ahead of time. You know, some of the pre-screening and tests we say you need to have specific lab work. You know, you need to check your electrolytes, your magnesium levels, your calcium, your liver, kidney panels, your CBC, which in the States is your metabolic panel. And there's certain things to look for. You want to make sure everything's in a really good limit. You know, sometimes we want this to happen like 2 months ahead of time, because if there is some deviances in it, we can help people with food or diet or supplements to come to a normality, so they're safe to come to the medicine. You know, thorough health and medical history needs to be looked at. You know, what are they bringing to the table? What are their comorbidities? You know, who are they? In-depth interviews are good, and with the potential participants, it really gets an idea of who they are, why they're coming to medicine, what are their intentions, their wants, their desires. You know, what have they heard about just a good general? We need to know who they are. You know, pretend you're going for surgery and they give you a workup, and, you know, in the pre-screening, they want to know everything about it so they can keep the safest container going. This is the same thing. This is soul surgery. A constant evaluation of mental and physical competencies. We want to know where your level of consciousness is, where you are, your awareness is, as you navigate through and even past and afterwards. Excuse me. It's important to know that and have the responsible and capable people carrying those out. EKG, you know, you need to have one done. End of story. It needs to be confirmed by a cardiologist or a qualified practitioner. Yes, that's somebody who's taken the time and is credited and can read them and sign and put their initials to it, that these are okay. But then you need to have someone who understands this medicine and to make sure that there's no conflictions with it as well. Then there's monitoring on site, you know, an EKG on site if possible, monitoring your blood pressure, your heart rate, heart rhythms with monitors if you need be. What is the O2 levels of this person, oxygen levels, if needed, if this becomes a problem, or if you think in advance it may become an issue, you know, an IV if necessary. You know, we need to have that kind of things available. Physical and cognitive assessments, and that's throughout the whole entire experience to see where they're at. It's so important to understand where the participant is at all times to ensure they're getting the very best and safest experience possible.
So one of the questions we get often is, in Gabon, they don't do these tests. And, you know, that often will speak to people's limited understanding of the incredible intelligence of the people in Gabon and how they're working with this medicine. They are very, very aware of the physical and mental interactions of this medicine. And they are blessed to have this incredible jungle full of medicines that they use, know, and understand. So it's a really incredible thing to be able to go into the jungle with them and have them teach you about the plants, not just the name of the plants, but what that plant does, how it works in your body, and the spirit of that plant. They are like an encyclopedia of the jungle. They are incredibly knowledgeable, the healers and gangas that are working with this medicine there. And they use other plants with Iboga. So when you take Iboga, you know, in Gabon and for, say, an initiation, they are using other plants during ceremony to help keep you safe and to help to ensure that you have the best possible ceremony, you have the best possible, you know, interaction with this medicine. And we can't forget that they've been using this medicine for over 2,000 years. And so they have a really deep knowledge and understanding of this medicine. And they work as a team. So when you are in ceremony, there isn't just one Ganga there. There are 4, 5, 6, maybe more there. And they'll be at all different levels of their training and understanding of the medicine and how it works in the body. So, you know, just as in anything, we can't all know everything. So they know that and they understand that and they work together to help each other in that area. And so let's talk about some of these contraindications here with this medicine. So the first thing we're looking at here is the medical and mental health conditions that we need to be really, really mindful of. So schizophrenia and bipolar. And we say problematic, you know, especially with bipolar, there's many variances of, I feel like bipolar, you know, some people can just be that depressive bipolar, which is not so much as problematic, but, you know, epilepsy, dementia, psychosis, you know, have they had a psychotic episode of some kind in the recently or in their history at all? Organic brain disease, you know, we got to look at the cardiac health. Have they ever had complications with their QT? Have they had a heart attack or you know, heart failure or in heart failure? Do they have hypertension or hypotension already? And where are they at in that? And what's their heart rate like? You know, some people can run high and run low, you know, and certainly anything around 50 beats a minute can be very problematic with this medicine. We want to look at their blood. Do they have, you know, issues with their blood, say clotting, DVT, anything like that? And of course, the respiratory. So Iboga puts you in a theta state, actually. And so that's like that dream state. It's a very, very relaxed state to be in. And so we want to know, like, do you have breathing problems? Do you have emphysema, COPD, asthma, like anything that's going to affect your CO2, or sorry, CO2, your O2 levels, you know?
You know, along with those contraindications, you know, we look for abnormal lab blood work. You know, we want to know what your potassium or magnesium levels are, your sodium levels, what your liver function, what your kidney function. These are all very integral in maintaining, you know, a proper homeostasis within your body with all your organs and your heart and your kidneys and your liver and your brain function. You know, is there any active infection that's currently with you? Is it ongoing? Is it chronic? You know, what kind of infection? How encompassing is it? You know, the body acts differently when there's a big infection going on. So we want your body to be able to act in a way that's normalized. So when this other stress comes on of Iboga, it's able to work with it, not all of a sudden start to collapse because it's already under stress. We always tell people no surgeries within 6 months. I mean, there are some surgeries, thumbnail surgery or something, I guess, remove a little wart, I guess. But for the most part, we don't want people, purging and having this stress and, busting a gut, so to speak, literally, popping a stitch or putting extra stress on their insides and their organs because of the surgery they just had. Pregnancy, well, we don't want you to be pregnant when you're taking it here. And yes, in Gabon, when they're pregnant, they take Iboga, but they do not take healing doses of it. They'll take a small microdose, and that's fine. But over here, when you go to a center or to a retreat, you're having, full flood doses, healing doses of it, which are not appropriate for a pregnant woman. We also look for anything acute for personal or family history, anything ongoing or reoccurring, like such as depression that's not treatable, or a psychosis, or depersonalization or dissociation, even recurrent UTIs. Like how frequently are they? How encompassing are they? So a really good history we need to watch for. Other contraindications are: is there IV access? Are their veins so bad from mistreating with drugs that they have no access at all? If all their veins are used up, then they're really not a candidate, because whether we give them an IV or they have to go to the hospital because of something else, they can't have IV access, then they're not a candidate. There's a lot of medications, that are contraindicated, and really just in general, the majority of the psychiatric mental health medications are contraindicated. And it's because they increase the serotonin levels, or they're prolonging QT and other effects that affect the person's well-being potentially. We want to avoid that. There are also foods, and just some listed are like bergamot or grapefruit, passion fruit. It's really a common thing nowadays. Ashwagandha, and there's a lot of functional mushrooms. And this is just a start. There's a plethora of it. We always say, ask your provider to really know what's contraindicated when you're coming to this medicine. And alcohol, well, we ask that everybody who's coming to this medicine be off for at least 7 days, because in that 7 days, when the person stops drinking, even if it's just one drink a day at supper time, because it helps with their food digestion, that can lead to potentially withdrawals or DTs, delirium tremens, and the last thing you want is someone in your retreat ending up with a seizure, going into a coma and dying, because that's what happens. Now, not everyone who stops will have these things, but you sure don't want it, so we stop ahead of time. And and if there's a real problem with alcohol, with abuse of it, and it's a real problem, then we ask for 30 to 60 days, because what happens is when you're really abusing your system with alcohol, you deplete yourself of nutrients, become malnourished. Your organs aren't working to their optimal, and we need you to come working optimal for you, not for everyone else, but just for who you are, optimal as possible to meet this big medicine. And stimulants, of course, are contraindicated. These are just a few: Adderall, ephedra, caffeine in big amounts, amphetamines, cocaine. There's a lot of things, and they're central nervous system stimulants, and we don't want that in the playing field, because Iboga is very much a central nervous system stimulant. It's going to work on all your nervous system, and so those things create like a wild card, make it really bumpy. They can make it very dangerous, and also they influence in how the medicine works. And then, of course, other plants and animal medicines. Let's not forget about them. Some interact with other things, but the big thing too is, we don't want someone doing a medicine of some sort 2 weeks or 3 weeks before they come, and now after they've done that medicine, they got to integrate these things that have happened mentally, physically, and spiritually to them, and make sense of what they've just gone through. And how can you do that? And all of a sudden, this big medicine is thrown in the pot. Now, you have even more, it can cause a lot of confusion and disarray. Likewise, after iboga or ibogaine, give yourself some time to integrate, and you're going to need to integrate. It's a long arc integration with iboga. It takes time as things come up and make sense and go through. And we've seen where people they take something else afterwards, and in good faith, some other medicine, and they end up with depression or a psychosis. So these are some of the contraindications. And there used to be the GITA guidelines, and it's now you can find it at ibogaineguidelines.com, and it's a really good place to go for a reference. So why did we create Soul Reflections? So 2 years ago, we were in Africa, and we got a clear message from the medicine, and that is to create a community. This medicine is a tribal medicine. This tradition is a tribal medicine. It's not a man all by himself, a woman all by himself, doing the best they can. No, it's working in a community. So we made this for a community. It's a private, Soul Reflections is a private platform by invitation only, and it's big on, we have a preparation protocol that help people get themselves ready for this mentally, spiritually, physically, get them ready. We have a great integration program that helps you work through it. And let's face it, medicine work, 95% of it's all integration. It's all after the experience and what happens in those times. And so a community is really important. And a lot of people go home after an experience and they're by themselves because people don't understand what's happened to them. Well, they don't have the support. And if they do, it's limited, and they don't know, they don't feel safe to discuss everything. So having a community that they're part of is really key. Builds that relationship with others, and it's a safe container where you can be vulnerable, you can work. Like I say, tribal medicines, there's many people working together, and it's what we're building here as a tribal community. Another reason we created Soul Reflections is for communication with other providers. When they work with this medicine in Africa, they don't just have one person provider working, they have the providers in Gangas and healers from all over the place, miles and miles and miles apart, come together, collaborate, work with people together. And it's for anyone who's working towards or with Iboga and ibogaine, this community is. So if you're thinking of working with it, or you are personally working with it, it's a really good place to come and join in and work through it. We also created for people serving medicine to help honor the tradition and the lineage of this beautiful medicine and this beautiful tradition. For offering retreats to those looking for answers and healings, for their spiritual growth and for a deeper soul connection, which is so very important. And of course, we also go to Gabon yearly, and we offer people to come with us to be initiated, to understand and get the lineage and have a deeper spiritual connection. And we're also offering continuing education through the lineage and the medicine as well.
So I think it's always important to talk about sustainability, especially with this plant. Iboga can be a very difficult plant to grow. It really only likes to grow in Central West Africa. So, and on top of that, it takes 6+ years for this plant to mature. And really, actually, the older the better. So it's if you think about somebody having a plantation that has to wait 6+ years before they get a return on investment, it's a long time. Deforestation has to occur to create new plantations as the need for this medicine grows, as more and more people become aware of it. Deforestation may happen, and you have to remember that the Congo and Gabon are they call it the second lung of the world. So we really don't want to be taking away from that jungle as much as we can. Elephants love Iboga. And they will destroy a plantation in one day. They will go in the night, and in the morning there will be very little left. And of course that's dangerous. It's dangerous for the farmers because they will stay there and and try to dissuade the elephants from coming in, and sometimes people are killed. So it is a big problem for them. And of course, there's poaching of wild iboga, making it hard to find naturally. So we really don't want to be using for global usage the wild iboga. You know, these plants can be 80+ years old. And traditionally what they would do is they would go in and just harvest a small amount of the root and leave the rest of the plant there to continue to grow. And but when poachers go in, they just rip out the whole plant, right? They don't care about that sustainability. They need money, right? So that is also causing a big problem right now. So solutions to this is to find ways for funding villagers to grow iboga within already established plantations or natural gardens. So the people in Gabon are hunter-gatherers, and they have plantations, but they are like just in and amongst the jungle. So they'll go out in the jungle, clear some of the bigger trees, and make room to plant other plants. But if you don't know, you often can't even tell you're in a plantation. It just sort of blends right in with the rest of the jungle. And so, and to use other plants to make ibogaine, you know, we got to get better at using those other plants for ibogaine, because that's the biggest driver in the market right now. And bees are amazing, and elephants don't like them. Apparently it hurts when they get stung, despite their tough skin. And so what is happening now is they'll create what they call bee fences. And so they'll strategically place beehives around plantations, and the elephants tend to just avoid it. And they'll go deeper into the jungle to get their food. And then also working with already established nonprofits to help protect wild iboga and the tradition. And one of them is Blessings of the Forest. And then we have Bwiti-informed. So Bwiti-informed was created by this beautiful woman you see down in the right corner. Her name is Elisa Mengui, and she is our translator and sister, and an incredible woman. And that's her with Sabi, her little baby. And she created Bwiti-informed, which means children of God, to help support her village, to create educational opportunities for formal and traditional learning, to help protect, you know, the tradition around iboga, for awareness and education purposes, and to give opportunity for local entrepreneurship. Sorry, excuse me. So Bwiti-informed's focus is to fund Indigenous-led environmental, cultural, and spiritual projects in rural villages in Gabon. And it's benefiting the economic growth and empowerment of traditional communities. So a few months ago this year, we created a new branch in the United States. It can be difficult to get money into Africa in general, right? And so one of the ways to do that, to help support, you know, these projects is helping eliminate some of that difficulty with the transition of money. So, and then Patrick and I will be working on a branch for Canada as well. So we're excited about that and the projects we have.
You know, a sample of some of the projects we're seeing moving forward is, you know, just recently over this last summer, you know, we had a donor, and we ended up being able to have a machine drilled well, which, you know, goes down enough so they can have drinkable water in the village. And that's so important to cut down the risks of infections, disease, bacterials, you know, and give them a better quality of life. We've had a donor, and they've donated for a house to support the students of the Bwiti and for the people who come to visit as well, locally as well. So that was completed. We have the African Rainforest Bees project that Michelle was just talking about, and that's initiated, that's just starting, and that's going to be a super, super amazing one we see as it unfolds. We're looking at doing an initiative for plumbing to the house and for the septic, you know, then again too, to discount the amount of infections or stuff that's going around. There's replanting of the gardens destroyed by the elephants is another initiative we plan on doing very soon. and of course, to build an outdoor kitchen. And, you know, with all these different initiatives and projects, we didn't just think, well, what do they need and what can we do for them? No, it's not about us. We asked them, what is it you guys need? What will sustain you? What will make you thrive? We want them to thrive without leaning on us, because that's not autonomy. That's not helping sustainability. If they have to lean on us and without us, they fall and fail. So this is something that they can do and be sustainable for. So we're really excited for these and for other ones that are going to be coming in the near future. So I want to say a big thank you to you guys for allowing us to come and talk to you about Iboga and ibogaine, the Bwiti, and the different initiatives that we're starting right now. And it's just our pleasure. We just love this so much. We love what we're doing. We love the people there. And feel free to check out our website at soulreflections.net and our Instagram and Facebook. And so if there's any more questions, we'd love to look at that.
Great. Thank you both very much. Cassandra, a while ago, she asked, is there usually vomiting throughout the experience? Do some people not vomit?
Good question. Absolutely correct on all things. And sometimes there is the purging, like orally. And just because you purge, like because you throw up in one ceremony, the next ceremony you may not. And you may not throw up at all. If you don't throw up, you're going to purge another way. And so that's fine. And so, you know, we always watch, like I say, we always watch to make sure that it's done in appropriate and it's carefully, you know, monitored for sure for safety.
So Philip, who's not here anymore, he asked, doesn't all that monitoring and possible IV during the experience affect it, being all wired like that?
Exactly.
Yeah.
Go ahead.
Yeah, so with ibogaine, you'll see a lot more monitoring. Ibogaine, it's because you have the higher concentration of ibogaine, like that's all you're getting with ibogaine, you know, not all the other alkaloids that potentially help protect the heart, right? When we're not using the whole plant. Nature is usually fairly intelligent, but there can be more stronger effects on the heart with just ibogaine alone. So you'll find, and because it lends to more of that clinical setting, so you'll find more monitoring. When we're working in a traditional way, we do those, like we check your blood pressure and your heart rate and all that kind of stuff prior to, and we have a little EKG that we use, 6 lead, and we check that prior to ceremony, prior to each ceremony. And then we would only repeat any of those things if we felt it was necessary, you know, as we're watching you go through that experience. So, yeah, so yeah, you're not hooked up to monitors the whole time with the traditional iboga for sure. Yeah, it would be very distracting.
It is. But you know, as a rule, you're generally coming in more healthy to a psychospiritual event than you are to an addiction, because your bodies haven't been regulated and you're usually a lot unhealthier. So there is real need for that.
Cassandra asks, how many people are typically part of a ceremony? Do you ever do individual work?
Yeah, so I mean, typically you retreat, depending on the amount of providers and medical help you have there, you can have anywhere from 5 to say 10 at tops, is kind of pushing if you have enough providers who are trained and support people and medical people. Otherwise, yeah, we do a lot of privates, one-on-one, or like us on one, or you know, or 2 people or maybe 3 people, like, so more private ones as well. And they tend to be, you know, a lot more work because we're there just for them, and there's a lot more interaction, you know, not as much downtime, and it can be more beneficial that way.
Yeah, I think what people don't understand is iboga is actually quite a labor-intensive medicine. People are really like, you know, you have your ceremony night, and then you have what's called Discovery Day, and you're not doing much on Discovery Day. And you're up, usually people stay in their bed for most of that day. And they still get a lot of insight from the medicine, and they still are really in what we say in the medicine. And so they take a lot of care and attention. And these are massive shifts. Like I said, people are shifting through, well, they're detoxing their body, and then they're having a massive mind purge, which can really feel quite overwhelming. For a lot of people, they feel like, you know, they'll be like, oh my gosh, I can't, like, there's so much in there. And when, you know, where did this all come from? You know, it might not even be theirs. It could be ancestral, who knows, right? Like, it's just this massive mind dump. And then also, there can be a lot of acceptance of things that maybe you were not taking responsibility for. So there's a lot of emotional support that goes along with that. So it's a very, and then integration day is often, you know, people feel quite good, but still their energy, I mean, even though they've kind of just laid around for 24, 48 hours, their energy, that was like, you know, a marathon that they just did. Their body went through massive shifts and healing, and they still are a little bit like they feel that, you know. So it's a powerful medicine that needs a lot of care.
Okay, a lot of questions coming in. Are you sleeping at all in those 3 days?
So yes and no. Next question. So it's Iboga as a general rule is a stimulant. So when we start, say at 9 in the evening, you take it, you're not going to sleep that night. That's a general rule. About less than 5% of people will be given a gift from the medicine to sleep. You know, yours truly included on that. But for the most part, it's not. The next day, you know, people will say, I'll ask them, so are you getting any rest? No, I don't think so. Well, if you don't think you're sleeping, then you're probably sleeping a little bits here and there, because we all know when we've had restless nights and we've been awake, you know when you're awake all day or all night, you do know. So there is, and as the medicine moves, there's more sleep that happens. And as you get the deeper sleep, there's more coming to the other side of feeling just that transformative section of it. So there is, it's not 3 days of staying awake.
No, actually sleep is really, really, really important. And I think, you know, we do things to ensure that people sleep on that second night, because you need that reset. Sleep is the reset. So Iboga's gone in and sort of flicked the switch, you know, so to speak, and like shuffled things up, and, you know, pulled open all the file cabinets and threw out all the stuff that was no longer serving you. And now you need sleep to like reboot. And so if people don't sleep, they can become confusional. So sleep is definitely something that you need to do and needs to be really well monitored and ensured that you get. But it's, most people will have at least like a good solid 4 or 5 hours, if not more. And some people sleep for 12 that night after Iboga.
And I mean, there's ways we can help intercede in helping people sleep. And it's important to say that you don't have to, and you shouldn't use medications from a prescription to help that. There's a lot of natural ways that we can help get you into a sleep state without going into some kind of medical semi-addictive pill of some sort or whatever to help you get sleep. So this is important to know that.
Great. For a bigger group, are things very private, or are there benefits of sharing experience and insights during ceremony and integration?
I think, you know, there are benefits that this is a community medicine, right? And so we learn from one another's experiences. And sometimes we can mirror one another as well. So being in a group is wonderful. And actually, usually the way we've done it in the past, we've usually always had small groups, right? But ideally, you would have your own bed to sleep in. It's a little harder if you share a room with somebody, because if you're able to sleep and your roommate isn't, then now you can't sleep. You know what I mean? So we usually like people to have their own room for sleeping, but the community of coming together and a shared experience is beautiful. And when people are on the mat with the medicine, like laying down with the medicine, what other people are doing is it's not even on your radar. So in that way, it's very private too.
But whether you're at a private, 1 or 2 people, or you're in a group of 5 or 6, there's community in both. There's community in both that you move through.
Yeah.
So you're never alone to do
No,
this
you should
by
never be
yourself.
alone, no.
And there's community, no matter if it's just one of you and the providers. So it's benefits to both.
Great. Peter asks, how long for Iboga? What is the length of a healing journey? Are there lighter journeys, duration and purpose for lighter retreat?
Well, so typically, traditionally, there's 2 ceremonies. You need to have space in between them so you can work through it and be ready for the next one. So that's usually like 7 or 8 days.
For Iboga.
For Iboga, right? For people who have done the medicine before, sometimes they come back for the weekend for one ceremony. I know with ibogaine, sometimes you'll have people come in for just the weekend for a weekend for this healing, and it's really not enough. It's really not enough. You finish.
Yeah. So so yeah, with ibogaine, we have to remember it's a quicker in, quicker out sort of a medicine, right? So you recover much faster. You need more time with it. You need to be supported longer after you take the dose.
Yeah.
And yeah, there's great benefits with microdosing. It's with being in a retreat that offers just daily microdoses to help you work through your problems. And like I say, it's a spirit, right? It's going to give us the insights that we need to help us move through whatever it is we're doing. Just most people want that deep dive because they really want to get to that. They really want to get to that work of that really deep inner work. And most people, when they come to an Iboga retreat, are coming after they've tried everything else, including other plant and animal medicines, right? So they've tried everything else. And there's still that thing that, behavior or addiction or pattern or whatever that whatever it is that they want to heal. And so that's what they're coming for. And it's usually why the deeper, higher doses are done.
Thanks. That's exactly what I would have said. Thanks. Much better.
Okay. We're going to try to go through a few more questions here. What are some of the differences between the Bwiti branches?
Well, for the most part, they just have different specialties. Some are healers and hunters, some are more philosophical, some are more tangible with the earth and things like that. But when it boils down to it, it's still about the tradition, and that's pretty much all the way across. So they're just basically just like different departments of the same kind of tradition. Right.
Yeah.
That's
the Fang is interesting because they've blended Christianity into the tradition as well. So you see some of those Christian elements in their ceremonies and in the way they talk about spirituality and that kind of thing.
Beautiful. So how much does Azuarini asks, how much does a ceremony or treatment cost and what options are available? Could you please let us know which dates are available for 2024, 2025? Also, a follow-on question by Peter is, where do you hold your retreats in the US?
Okay, so right now we're holding our retreats in Canada. It's just above the US, so short distance, short plane ride for anyone who doesn't know where we are. No igloos here. but that's where we're at. Just because it's a little trickier down the States.
Yeah.
I mean, we've been down there before, and but it's still a little bit trickier to go through there. You know, it's kind of an underground movement everywhere. We are definitely above ground. People know who we are, and we're not shy of that. As far as the costs and that, we do have information that if you use our email address, which is at info@soulreflections.net, we're more than happy to give you information, what things look like, you know, a complete layout of the retreats, the costs, what's involved. And, you know, as a rule, you know, an Iboga retreat is significantly less than ibogaine treatment. And it's because it's supply and demand, and they know when they're doing ibogaine, they can kind of charge whatever they want to charge. And it can be a lot more.
Yeah.
And there's nothing wrong with it, with their parts, and that's fine. If that's where you want to go, that's fine. And we never, you know, discourage that, but that's just the difference between them.
And we don't do active addiction.
No,
So
yeah.
where you know, ibogaine centers are set up to really support that
Mhm.
really active addiction. Although we do we're always working with addiction, because like we mentioned before, addiction comes up in many different
Mhm.
ways. But and we can work with people, but it's a lot more intensive, and they have to not be using when they come to us.
Yeah.
And so we have to support them a lot before they come, and they have to be really willing to do that work.
Mhm.
Yeah. I don't know if there was more in that question, but
I think that answers it.
Yeah, it's okay. If people want to learn more, they can go to your website or email
yeah,
you.
Yeah.
it's really individual because we're working with you one-on-one.
Yeah.
How much? Ninoa asks, how come Iboga retreats cost as much as they do? Ayahuasca retreats, I've noticed, often cost way less.
Well, ayahuasca retreats are usually just a weekend. So Iboga retreats are 8 days, so they're twice as long. Ayahuasca doesn't last as long.
And there's a lot more things to watch out for with Iboga, right? The biggest thing being the cardiotoxicity, which is totally preventable. But if you don't do it properly with medical staff and proper support staff available there, you can run into real problems. And, you know, and that's something we just don't want to see happen. So that's generally why you see it, they're more expensive.
And I don't necessarily agree with a lot of Iboga or ayahuasca retreats can be like a lot of people at one time. And that's a lot of spiritual energy. And I don't, so you can have, if you're only working with, 3 or 5 or 10 people, that's a lot different than working with 40 or 50 people in a room. So your overhead per person is not as much, right? There's a lot of things. And we have to understand too, some of the things that we are watched for with Iboga should also be watched for and monitored with ayahuasca, right? And I don't know if it is as much, and that really is the electrolyte imbalances that can happen with massive amounts of purging. And I know we have heard in the past people getting in trouble, and I don't know if it's talked about as much, and I think we need to talk about it more. We need to support people better in both retreats, and keeping people safe.
Beautiful. Thank you both. So we've reached reached the end of our talk here. Thank you so much, Michelle and Patrick. Any last words you'd like to say to the community?
Iboga is a beautiful medicine. It loves to love you. It loves to help you work through things and find out who you are. And it loves to help you reconnect to your soul. And we're just very fortunate to be people who can help others through this and guide them to there as well. And it's about you healing yourself. It's not about any provider healing you. It's about you coming to a space where you can heal yourself.
Yeah.
And feel free to look us up on our website or email us.
Yeah, even if you have more questions.
Yeah, absolutely.
We're always happy to answer people's questions.
Beautiful. Thank you everyone for showing up,
you.
and
Thanks so much.
yes, wishing you all a great day.
Uh,
Yeah. Bye for now.
bye.